Yeah, thank you very much, PRO. I'm David Jan Darko, the municipal manager for Awutu Senya East NSS. As you know, the Naspa cannot do anything without the municipal manager. So they came to me with their plan that they want to have a health screening within these 2 or 1 month or so. So they came to me and then I sat with them here and then we discussed everything and then I gave them the go ahead to do it.
Okay, my name is Ernest Kumi. I'm the assistant manager for Awutu Senya East NSS. Okay, thank you very much. So it started as a proposal from the NASPA executives to organize such wonderful activity. So when they came, we sat down with them. They brought their proposals and we agreed. We saw that it was good. So we asked them to submit a proposal because whatever you do, you need sponsorship. So we asked them to submit a proposal for us to be distributed to all the various institutions that will help them with sponsorship. So they brought them, then we started the distribution, and so far it's been wonderful. Though there has been some challenges, but most of the institutions we approached heard to our cry, and they've all come on board to support. So far it's been wonderful.
So can you really help us, take us through the process? What exactly are we doing today?
For today, when a person arrives, first of all, he or she registers at the first center, he or she meets. After that, the person visits to where the nurses are by checking the BMI, that's body mass index. After that, your weight and other items. From there, then you move to eye screening. From the eye screening, then you move to the HIV status. That's where you'll be checking whether you are positive or negative.
You are part of the architects of this particular health screening. I must say and commend you for the very good work or the hard work you've done. I know the effort you actually placed in this screening that is going on. I want you to give us the view of what you see today.
First of all, I would like to thank God for how far He has brought us. It wasn't easy. Since day one, we had this vision to embark on this free health screening. There have been a lot of ups and downs, but still we were determined to make this a successful one. So God being on our side, we have been able to organize this. For now, I can see that the members are really patronizing the exercise very, very well. I'm even overwhelmed with their participants and their attendance this afternoon. We are even expecting more later in the afternoon, around 3 or 4. They'll come in their numbers. So I think so far so good. So far so good. And also God Almighty has been good to us. It has not rained. It is shining as you can see. So it has been good so far.
You're welcome.
Thank you very much. Thank you very much.
I want us to give us a brief history of what really happened before this graceful occasion.
Okay, thank you very much for the opportunity given. Some weeks ago, we received a letter at the Health Directorate that the National Service Personnel Association would want to organize a free health screening. And then we said this is very good initiative because health is moving towards prevention and not really creative. The world is now focused on non-communicable diseases, especially hypertension, diabetes, and those diseases that you don't really see it as early stages, but before you realize, then it takes you to your death. Hypertension, for instance, is called silent killer because normally you will not see the signs and symptoms until it has gotten to that point where you get a heart attack or a stroke. So once the health is moving towards prevention and not the clinical, the health director thought it wise that it is important that we partner with you, and then we put in all the efforts that we can for the community, for the national service personnel aged between 20 to 35 to start health screening or to start with screening at this particular or at these early stages in their life. And then we realized that our audience also have the drivers and then other officers. So when we realized that these audience are all part of the team or those that the association would want to screen, we realized that it is an important initiative that we all come together and then we make it successful. Being here, you can see that yes, everything is going on smoothly. What I'm happy about is that the young ages are the ones who are really, taking part in the screening. It tells that going forward, when life gets in the later parts of their life, they will still see health screening as important as it is today.
Thank you, Mr. Frank.
Yeah, in fact, I'm very, very grateful especially for the NASPA executives. They've really, really, really worked very, very, very hard. The president, Kingsley, the vice president, Daniel, the PRO, the general secretary. In fact, especially the general secretary, he's using his own means. That's a motto. He takes them round all over to do the transactions. And in fact, it has been very, very, very successful. As of this morning, when I went there, the patronage, is very, 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 very great. Very, very, very great. And I'm very, very, very happy that everything was successful. Especially those who sponsored. We have the Ghana Immigration Service, Ghana East Commission, Awutu Radio, and GPRTU Obom Road Station. They all agreed to sponsor, and it's ongoing. I've been there myself. I've had my eye screening, and then it's very, very successful. Very, very, very successful. As at now, if you go there, the people there, they are more than 50. Since morning, not less than 50. They are there doing the screening, and it has been a successful event.
Okay, I came very early today, and I met the executives, the NASPA executives. All of them, they brought chairs and other to mount the stage, and the personnel also. It's very encouraging.
So for your arrival, what do you see?
We heard of the advertisements that they'll be doing a free health scheme today, and as we can see, everything is going on well.
Okay, so when you got here, how was the feeling like? Did you expect it was going to be this big, or you thought it was just going to be one?
We thought it was going to be small, so we are all surprised. We didn't know people would be here like this.
That's fine.
What can you tell us about the screening so far?
Oh, the organizers, they've done very well.
Okay.
And then the nurses and the doctors also are very good.
Okay. So
the reception was
okay. So you like what you saw here today?
Yeah, I really love what I saw here.
Thank you very much.
Actually, the screening is purposely organized for national service personnel. We also invited other community members, anyone who wish to attend. We actually want to say that we think about the welfare and the well-being of our members, actually their health. We want to see them very strong and vibrant so that they can always go to work and work from Ghana as well.
We've realized that we are growing as humans, and the more you are growing, there will be some changes in your body at which you need to pay attention to it. Because of the stress in work places, some people may not have time to visit hospitals to check about their vitals. So it has been very necessary for us to organize this program for such people, that is for our people. Because looking at the working days, from Monday to Friday, everybody will be at work, spending all the hours at church, at work. So meaning that we have to take a time out of their working hours, like a day like this, so that we organize this for them. Health is very important. We don't have to wait till we are a victim or fall sick before not paying attention to our health. That is very wrong. But checking it regularly will also allow us to know our way forward. When are we, excuse me to say, when are we visiting the hospital, or when are we going to have a disease? Right? We might not know till we check our vitals and know which organ is strong and which organs is weak and which one are we to pay attention to. That is it. That's how we organize this for our people.
We want to know what other words of encouragement do you have for us, and then for other national service personnel across the country?
For me, as a health promotion officer, I'm enthused, I'm amazed, I'm happy. What I would say is that I wish this can go on every year. So what I would want to say is that we shouldn't end it today. It must be a continuous process. Health is a continuous process. We don't stop at one point. We continue to do it. So I hope that those who will follow you would also bring on board new ideas to improve what we are seeing today. So that is what I would say for now.
Thank you, Mr. Fry.
Yeah, I hope it is very, very good for the other NASPA executives in the other district also to embark on it, because this is a health screening, and as for health, everybody needs it. Everybody needs to to know your status in what is going on in your body. So health screening, in fact, is very, very good, and I thank my NASPA executives for taking the initiative to have this program.